So let's say I'm a patient and I need a hip replacement, which is one of the more costly orthopedic surgeries, I think. And so I've gone through the normal steps, and it's been determined I truly need one. That's always a question, right? And I'm have worked closely with Keith Smith as well. He wrote the foreword for my book, but he said the best surgery is the one you don't need or have.
Exactly.
So, but let's say in this case I do need a hip replacement, and I've taken the proper steps of imaging and so forth, which we can also intervene in with shopping. But we're at the point where I need surgery now. I'm talking to you, and let's say I'm saying I'm considering going to Solstice Health. I'm also considering going to a local hospital. How can you ease my questions or concerns about, like, who's going to be doing this surgery? How do I know this person knows what he or she is doing, that I'm going to have a good outcome? So I know the cost is good, but now, how can I be assured this is maybe a part of my body that I'm going to need the rest of my life? And how can you comfort me in knowing that I'm having a good surgery?
Yep, that's a great question. And we get that a lot, especially being, I would say, a smaller player in the market, if you will, compared to the hospital systems, who, by the way, we work with if we need to. We're not looking to replace hospitals. We're certainly looking to compete on the price point, because we know that we can do it better and cheaper. But for a patient that's coming in, I guess my first response to you would be, did you do your research on the hospital setting? Did you ask someone, hey, how many surgeries has this guy done? Is he really legit? So on and so forth. But oftentimes that question is not posed when you're going into the hospital. Patients blindly walk in, they get assigned to a surgeon. They may meet with the surgeon and really like the guy, but you don't know how long he's been in practice. You don't know what he's really doing in the operating room behind the scenes, how he interacts with staff, how he interacts with patients. But yet people still go in and they'll foot a $50,000 bill or a $60,000 bill for this particular operation. I have spent the better part of the last 12 years, I would say, as an independent contractor and anesthesiologist, going from hospital to hospital in the local market and working with all of these surgeons. So what I can tell you is there is no better person who knows how a surgeon works and how they interact with staff and the quality of care that they deliver, other than your anesthesiologist, because we get to sit there the whole time. We get to put the patient to sleep, and then we get to interact and sit there and with the rest of the team. So I've been able to go around the state and really sort of look and sit and say to myself, who would I want operating on my son? Who would I want operating on my wife or my mom or my dad? And be able to hand pick these people as a team to be able to work at our facility, which is it's yielded extreme value, because all of these people, including myself, I'm a board certified anesthesiologist. I've been doing this now for 20 years. The people that I work with in the operating room are board certified orthopedic surgeons, GYN surgeons, pain docs, ENTs, all of these people, because we run a multi-specialty surgery center. And I've been able to sit with them and talk with them and understand their practice and be able to say to them, hey, if I had extra work for you to be able to do to add to your current volume, would you be willing to do that? And the answer was always a resounding yes. And the reason it was a yes is because when you take yourself outside of the insurance world, we can get our patients in a lot quicker. They're getting the exact same, I feel, better quality of care, because they're able to get in quicker, see their patients for a longer period of time, and be able to really have a relationship, because our surgeons are going to come in and operate with us, and we're able to collectively do that and be able to not have to leverage the insurance and get prior authorizations and do all these different things. We're able to get these studies much quicker through our direct primary care facility, and get them in to see everybody on a much quicker basis and get their surgeries done quicker. And that's really what the patient wants, aside from the cost part of it. They want to be able to have a better opportunity to have a better form of care, and do it at a really cost-effective price. So that's how I've been able to do it over the years. I think when you walk into a hospital, sometimes hospitals don't really have a metric. They're looking at a person's CV. They're looking at where they trained. They're looking at, if they have malpractice insurance, whether they have any prior lawsuits, et cetera, but you're not really getting in. The CEOs don't come down into the operating room and look at how we operate. They don't look at how we put people to sleep. They don't interact with us. I've been able to do all that. So we've created sort of a different environment with the world-class surgeons that we have in our market to be able to operate in our center and have the same board certified people working in a smaller center doing it for 70% less.
Okay. Very interesting. I mean, kind of a theme that I've seen, at least in Oklahoma and Indiana, and now yourself with these anesthesiologists, right? I mean, who knows who's the best, who's right there beside him, as you mentioned, for the one to be the facilitator of these surgeries and handpicking doctors and knowing who's the best and who's average and so forth. It's great information.